My dear students. Welcome, my dear students. Welcome back, everyone. A new lecture in the dementia and things which we must know about the dementia. And now, today, we are talking about the gentle, persuasive approach. Persuasive approach. Let me share the screen and tell you what I have here with me today in this lecture. And we will just navigate about the course and the contents of the course in a few minutes. First of all, I just want to tell you there is a person, one new case of dementia every 7 seconds. This is reported by the medical authorities in the United Nations World Health Organization. They said that there's one case of dementia every 7 seconds. And this which means it's not a small deal. It's a very big deal that there are many cases every 7 seconds means the world is full of the cases of dementia. But we talk about the dementia, we say what is the meaning of the dementia, and we will say also the stages of the dementia, and each stage, the role of the personal support worker in each stage of these stages in dealing with the dementia cases. But first of all, we just want to see what is the meaning of gentle, persuasive approach. Like what you see here in front of you, gentle, persuasive approach. Persuasive, like to deal with, or how to deal with, how can we deal with this? Gentle, persuasive approach of the GPE encourages staff to reframe responsive behavior as self-protective expressions of unmet needs and learn to assess their meanings. So when I talk about the gentle persuasive approach, I talk here about how can the personal support worker or the healthcare giver can defend himself or defend herself against the attacks of the patients, because some of the patients here, we will know that some of the patients are feeling always aggressive, like as example, the sundowning. We talked about the sundowning before. And in that case, the patient is very aggressive, and especially in the nighttime, and he starts to behave aggressively. How can a personal support worker in particular, or healthcare provider in general, deal with some types of this behavior? That's what we'll see here. So the study is navigated in 4 modules for the moment. The module 1, we will go to the contents of module 1. On module 1, persons with dementia can experience the loss of what? What are the things? We are saying just now a summary or a brief about what we're going to study in this course. But just I want to tell you also that what we are studying here in this course is these things like a person with dementia can experience also things like, as example, the memory, judgment, attention, the mood. These are the things which can be lost. These are the things which can be lost: communication abilities and ability to complete activities of daily living, the ADL. So here, and I will divide it in another video into, just today we are navigating what are the topics inside this 4 modules. So persons with dementia can experience the loss of memory, judgment, attention, mood, communications abilities, and abilities to complete activities of daily living. The ADL also is one of the things which they missed as well. A person with dementia deserves to. These are the rights of the patient. These are the rights of the patient. So the rights of the patients are, like, as example, he has the right to be informed of one's diagnosis. So if he's a case of dementia, we don't hide on him. We have to tell him that you have dementia. We have to tell the case, inform him or his beloved or his family that he has developed dementia, or that he's affected, his dementia affected. So he must be informed. This is his right. This is the first thing. Secondly, have appropriate ongoing medical care. There must be a medical care for this patient, and this is the second right. Third thing, be treated as an adult. listened to, and afforded respect for one's feelings to the points of view. We treat with dignity, like we said, this is one of the rights of the patients in general, the dignity. Treat them with dignity, let them have their own pride, let them have their autonomy or the personal choice, respect their feelings, respect their so all these things, like, it's very important also to be put into consideration when we deal with the PSW, or with the when a PSW deal with dementia case. Be with individuals who knows one's life story, including cultures and spirits traditions. So the person or the healthcare giver, he must be aware, fully aware about all the surroundings, not only the case of the PSW, the case of the dementia, but he also must include, has a background about the culture and the spiritual traditions of the patient as well. He must be aware, the PSW who's there must be aware about the patient. Also, we're still talking about the rights, the Bill of Rights for a dementia patient. We're still working about the Bill of Rights for a dementia patient. And we will go now to the next point, which is on this page. We said here again to be informed of diagnosis, to have his medical care, to be treated as an adult with respect, of course, with respect, and to be with individual who knows one's life story, including cultural and spiritual traditions as well. Also, he must live in a safe and stimulating environment, be outdoors on a regular basis, be free from psychotropic medications wherever possible. Also, have welcomed physical contacts with beloved people who cannot isolate him from his people, including hugging, kissing, and hand holding. And also the physical contact, like treating him, holding his hand, or putting his hand on the shoulder, or all this is kissing, hugging, all these things has to be welcomed as well. Be an advocate for oneself and for others. Be a part of a local, global, or online community. Have care and experience meaningful engagement through the day. These are the rights of the case of dementia or the dementia patient, his own rights or her own rights. I will repeat it back again because this is the part of the module 1. So the person with dementia can experience loss of memory, like we said, judgment, attention, mood, communication skills, ability to complete activities of a daily living. We set a bill of rights for dementia patients. As example, we have the right to be informed, the rights of the dementia patient, his rights. He has to be informed and diagnosed about his diagnosis, about that he's having a dementia. Secondly, he has to be appropriate ongoing medical care. He must be treated as an adult. He must be treated with respect. Be with individuals, like the individuals here is the healthcare provider, or the PSW, whoever will be sitting with him, who is having physical contact, will have a long time contact with the patients, who knows one's life story, including cultural and spiritual traditions as well, and so on. So all these are the rights of this patient. Live in a safe and stimulating environment. Be outdoors on a regular basis. Be free from psychotropic medications whenever possible. Have welcomed for the physical contact, like the hugging and so on. And plus all this, be an advocate for oneself and for others. Be part of local, global, online community. Have care. You must have the care as a patient. Experience meaningful engagement through the day. So keep him always engaged and keep him always attentive as much as you can. The aspect or the rights of the dementia patient also. I will go to Google search now, the rights of dementia patients, and also we'll go for some points. The dementia patients rights. The dementia patient's rights, and we'll look here, and we will find here some points. Images sometimes one picture can say what 30 pages can say in words. I prefer the Bill of Rights here to see it from here as well. Here we go. And we will increase it. And it doesn't make no sense. It's like the same ideas which we talked about before. Every person diagnosed with Alzheimer's, which Alzheimer, like we said, is the major reason for the dementia. Like 70 to 80% of the cases of the dementia are derived from the Alzheimer or was developed by Alzheimer. To be informed of one's diagnosis, this is the rights. Every person diagnosed with Alzheimer's disease or other dementia. So all about the dementia here had the rights to, let's go to the pen, take our pen so that to be informed of one's diagnosis, to have appropriate ongoing medical care, this is the second point, to be treated as an adult, listen to and afforded respect for one's feelings and point of view, to be with individuals who knows one's life story, including cultural and spiritual tradition, that's what I said before, to experience meaningful engagement through the day, to live in a safe and stimulating environment, to be outdoors on a regular basis means to take him out just for a small ride or for a picnic. If you are driving, can be sitting beside you, or if he's pushed on a wheelchair or whatever, or if he's walking, you should give him as a PSW the support to let him walk and so on. To be free from psychotropic medications when possible, and also to have welcomed physical contacts, including hugging, caressing, and hand-holding, to be an advocate for one's self and for others, to be part of local, global, or online community, and to have care patient partners well-trained in dementia care. So this is very important, the last one, that the people who will help him as dementia care, they must have the experience. The healthcare providers or the PSW, they must be very experienced in dealing with the dementia care, like what you see in front of you here. Right now, I will go also into another slide here about the dementia case, the rights of dementia case as well. We'll see, check out the rights of dementia case and see back to this here and back again. See something about the cases of dementia, or the rights. And actually, it's the patient of dementia is one of the patients and has the rights, the patient's rights. So we'll go to let's go for here. This is a direct one. We'll choose it right now and watch it together. I think it's impressive here. Let's go for this one.
Recently, the Alzheimer's Society of Canada launched the first ever Canadian Charter of Rights for people with dementia. The creation of the charter was driven by Canadians living with dementia. We spoke to those Canadians to hear why each right is important.
As a person with dementia, the following rights are especially important to me. I have the right to be free from discrimination of any kind.
It's been my view that the stigma that goes along with this disease is the biggest problem. There's an immediate feeling that you no longer have the competence required to carry on a day-to-day basis.
So I think it's important that whenever you speak to somebody or whenever you talk to someone, you try to get the impression of what level they're at and then talk to them in that.
It all boils down to understanding. And if people would show a little compassion, kindness, trying to walk a mile in the shoes of whoever it is with dementia, I think that would do the trick.
To benefit from all of Canada's civic and legal rights.
This right overrides the stereotype of a person with dementia, because when you consider the stigma or the stereotype, that is actually a diminishment of rights. But this says quite clearly that a person with dementia does have the right
to participate in developing and implementing policies that affect my life.
Too many times policies and procedures are developed without any input from the people who will be using them. This happens in life and in the workplace. I feel it's great to have some input, as this is for the people with dementia and other disabilities.
There could be many things overlooked. Not getting that perception and understanding the nuances that someone with dementia could offer.
One of the hardest decisions that I want to be able to participate in is my final exit. There is a great challenge in having to make decisions many years before they are implemented. I'm one of the persons living with dementia who insists on this option.
to access support so that I can live as independently as possible and be as engaged as possible in my community.
This helps me meet the physical, cognitive, social, and spiritual needs.
Get involved in community and civic opportunities.
And access opportunities for lifelong learning.
The more you can become involved, the more you can be seen out in the community, the more active you can be socially, physically, etc. That helps to eliminate the stigma that goes along with this disease.
The perception of a person with dementia is that you are diagnosed and you go right to long-term care. The ability that this charter provides people with dementia is the affirmation that you are able to access services, to live in the community, to live well in the community, because as they say, you're better at home, and putting it in writing with the charter reinforces that.
When you're diagnosed, don't sit in a corner. Try and get out, be as active as you can, and let people know that you're still competent.
To get the information and support I need to participate as fully as possible in decisions that affect me, including care decisions from the point of diagnosis to palliative and end-of-life care.
Getting accessible information and support is important. After I was diagnosed, I needed to find out how I could prevent my cognitive decline. But it was a challenge to find information about what to do.
But the minute that you're diagnosed doesn't necessarily, that's the minute that you're unable to make any decisions or anything for yourself.
I want to be told. I want to have the privilege of knowing what my diagnosis is, for starters. And I want to have the privilege of choosing what my life is going to be, not what someone has predestined me for, or what anybody else has an idea that Alzheimer's is.
To expect that professionals involved in my care are
trained in both dementia and human rights,
held accountable for protecting my human rights, including my right to get the support and information I need to make decisions that are right for me.
Treating me with respect and dignity.
Offering me equal access to appropriate treatment options as I develop health conditions other than my dementia.
I've had some bad experiences with some of the professionals that I've met.
Sometimes they almost treat you as a child, because a lot of the stigma around Alzheimer's is that they say you've gone back to a childhood outlook on things, or maybe a childhood mentality. And when you are treated like that, sometimes it's a little bit demoralizing, and they're trying to over-explain things to you.
To access effective complaint and appeal procedures when my rights are not protected or respected.
All of the rights are very valid, but they're pretty much useless unless there's some way of making sure that that they can be supported.
Not everyone has such a positive experience getting the support they need.
And number 7, which is to access effective complaint and appeal procedures when my rights aren't protected, it gives credence to what the rights are.
We, the people with dementia and other related diseases, feel that it's important to be able to participate in our well-being for our future and in the journey with this disease.
It will take the effort of every Canadian to protect and respect the rights of people with dementia so that we are seen as valuable and vital community members.
There's 1,000 faces to dementia, and we in society need to recognize all those faces of dementia right from the beginning to the very end. And if people do that, a lot of perceptions, a lot of problems that we have in this day and age towards people with dementia, a lot of those problems will just go away.
Guys, I put for you the link of this video down. I put the link for this. I put it in the slides, so you can get back to it. This is the Canadian Charter of Rights for the people with dementia. The Canadian Charter of Rights for people with dementia. And it's very clear right now. It's important because it's on the ground itself. And you can see here the people who has already dementia having their own feelings, expressing their own feelings and their own needs and things which they feel they are in shortage with or in lack to. They are in lack for what? For the expressing themselves, more involvement in the society, not to be treated like small kids, and like what you heard in the video. I will keep for you the link so that you can go back to it in any time. Now, I will just move forward back to my slides, back to our slides, and we'll move back to another question. We'll end this part. We'll end this part with a question that you guys just start working on it. This is here. Question 1 today. Discuss the rights for people with dementia. Then apply this into the Canadian patients, I don't want to say clients, patients, and patients with dementia. So this question will stop here like around 5 minutes to take your answer, guys. You don't need to send me the answers. I just want you to write down inside a note so that you know what are the topics we go gradually in right now. And this is the first topic which we'll talk about is the rights of the patients of dementia. Before we go to the aspects of the dementia and the reasons for the dementia and so on, we have first to know the rights of the dementia. The rights of the people who are affected or develop dementia, how they can live and how that's what we said before. And I put for you also the video link for the video, which was what we was watching just now. Here it is, just 1 second. You can guys go to this video and watch it also. And you will see here in this video the rights, so you can get it. And I will put for you here the link, so you can go to it. And also here the video says results. When you press it like this, you will go directly into the video and OK. Then it will take you back into the video which we're talking about here, the Canadian Charters of Rights. About the, you have here this video as well. So this is the points which we want to talk about right now. This is the points which we want to talk about right now. And shall wait here for your answers, like around 5 minutes to get the answers of this question. Discuss the rights of people with dementia. Apply this into the Canadian Patients with the Dementia Society. And here is the first thing. So please work on this question. Make your notes. Shall be standing here like around, stopping here like around 5 minutes to get your answer, guys, before we move.